DVT, or deep vein thrombosis, is a serious condition where blood clots form in your veins, usually in your lower leg, thigh, or pelvis. Sometimes, it can also affect your arms. But it's not just your limbs that are affected, your heart can also be impacted by DVT. In addition to DVT, there's another type of blood clot that can occur in your cardiovascular system called arterial thrombosis. While these are two separate conditions, they are related to each other. Now let's talk about some of the causes of DVT that are related to heart disease. First, heart failure can slow down your blood flow, making it easier for your blood to clot. Atrial fibrillation, or irregular heartbeats, can also increase your risk of DVT by affecting the way blood flows through your heart. In addition to heart-related causes, there are other factors that can raise your risk of DVT, such as genetic diseases that affect blood clotting, birth control pills or hormone replacement therapy, inactivity, diabetes, being overweight, having metabolic syndrome, being pregnant, having cancer, and smoking. All of these factors can increase the likelihood of developing blood clots. Think of DVT as a traffic jam in your veins. Your heart depends on these veins to bring back oxygen-poor blood from your body. The clots from DVT may not happen in your heart, but they can travel through your heart to reach your lungs. The right pumping chamber of your heart, called the right ventricle, sends the oxygen-poor blood to your lungs. After picking up oxygen, the blood returns to your heart and then gets pumped out to your body through arteries. When you have DVT, there's a risk of developing a serious problem called pulmonary embolism, PE. This happens when part of the clot breaks off and travels through your heart towards your lungs, blocking the blood flow and preventing the oxygen from reaching your lungs. PE is a serious and potentially fatal condition, but it can be treated if caught in time. The warning signs of PE include shortness of breath, dizziness, chest pain, fast pulse, and coughing up blood. It's important to recognize these symptoms and seek treatment quickly. In addition to PE, DVT can also lead to complications in the veins and skin of your legs and arms. This condition, called post-thrombotic syndrome or post-phlebitic syndrome, can cause swelling, pain, skin discoloration, and skin sores. While these symptoms won't directly affect your heart, it's important to address them to prevent further complications. When oxygen-rich blood can't reach your brain or heart, it can lead to dangerous events like stroke and myocardial infarction. These conditions occur due to blockages in your arteries, but DVT, or deep vein thrombosis, happens in a different part of your circulatory system that doesn't carry oxygen, so it can't cause stroke or heart attack. However, there is a connection between stroke and DVT. People who have had a stroke are at a higher risk of getting DVT. This may be because conditions that increase blood clotting can make you prone to clotting all over your circulatory system, in both your arteries and your veins. Strokes may also cause loss of movement, which is another risk factor for DVT. Immobility can lead to dehydration, raising the odds for DVT. Medications that prevent clotting in people with heart disease can also prevent and treat DVT. Doctors may prescribe anticoagulant drugs to reduce the risk of blood clots in the body, especially for those with heart arrhythmia, or who have an implanted heart valve or stent. If you have DVT, your doctor may prescribe these medications to prevent your clot from growing or breaking off.